Azure Sampona. Today I'm going to demonstrate the Glasgow Coma scale. It's the summation of score for eye, verbal, and motor responses. The score is determined by the sum of the score in each of the three categories with a maximum score of 15, which indicate a fully awake patient, and minimum score of 3, which indicate deep coma or a brain dead state. Purpose: the Glasgow Coma scale is used to describe the general level of consciousness in patients with a traumatic brain injury and to define broad categories of the head injury. Procedure number 1. Perform hand hygiene. Rationale: to prevent spread of microorganisms. Number 2. Initially observe if the patient is opening their eyes spontaneously. Rationale: to evaluate patient with wakefulness and awareness of the environment. Number 3. If the patient is opening their eyes spontaneously, your assessment is complete, score 4 points. You will then move on to assessing verbal response. Number 4. If the patient is not opening their eyes spontaneously, you need to work through the following step until response is obtained. You need to speak to the patient. Number 5. If the patient eyes open in response to the sound of your voice, score 3 points. You will then move on to assessing verbal response. Number 6. If the patient does open their eyes in response to sound, you need to move on to assessing eye opening to pain. Example, applying pressure on the nail base of the finger for 10 seconds. Number 7. If the patient eyes open in response to the pressure on the nail base of the finger, score 2 points. You will then move on assessing verbal response. Number 8. If the patient does not open their eyes to a painful stimulus, score 1 point. You will then move on to assessing verbal response. Number 9. If the patient cannot open their eyes for some reason, trauma dressing. You should document that eye response could not be assessed. NT, you will then move on to the assessing verbal response. Number 10. Initially try to engage the patient in conversation and assess if they are orientated. Some common questions you can ask to help assess this might include: Ma'am, ano pong pangalan natin, ma'am? Ma'am, alam mo ba kung saan tayo, ma'am? If the patient is able to answer your question appropriately, the assessment of verbal response is complete. Score 5 points. Then move on assessing motor response. Number 12. If the patient is able to reply but the responses don't seem quite right, they don't know where they are or what the date is, this will be classed as confused conversations for 4 points. Then move on assessing motor response. Number 13. If the patient responds with seemingly random words that are completely unrelated to the question you asked, this will be classed as inappropriate word. Score 3 points. Then move on to assessing motor response. Number 14. If the patient is making sound rather than speaking word, then this will be classified as incomprehensible sound. Score 2 points. You will then move on to assessing motor response. Number 15. If the patient has no response to your question, score 1 point. You will then move on assessing motor response. Number 16. If the patient is intubated or with ostomy, or has other factors interfering with their ability to communicate verbally, the response cannot be tasted, and for this you will write empty. You will then move on assessing motor response. Number 17. Ask the patient to perform a two-part equation. Lift your right arm off the bed and make a fist. Fish. If the patient able to follow this command correctly, score 6 points and assessment will be over. Rationally, to evaluate patient ability to obey command, localize, withdraw, or assume abnormal body position in response to a painful stimulus. Number 18, if the patient does not obey the command, apply painful stimuli. If the patient makes attempt to react towards the site at which you are applying a painful, and bring their hand above their this will be classed as localizing to pain. Score 5 points and the assessment will be over. Number 21, if applied a painful stimuli and the patient respond with an if you applied a painful stimuli and the patient respond with an abnormal extension, score 2 points and assessment will be over. Number 22, if you apply the painful stimulus and the patient has no response, score 1 point and the assessment will be over. Number 23, if the patient is unable to provide a motor response, this should be documented as not testable. Number 24, once you have assessed eye-opening verbal response and motor response, you add the score together to calculate the patient GCS. Rationally, documentation contribute to continue data collection necessary for the client care plan. Number 25, the GCS should be document showing the score for each individual behavior tested.